I want to ask you something personal. Think back to 5 years ago. Could you walk to the end of your driveway, stand in the kitchen and finish cooking a whole meal? Or move through a grocery store without your legs slowing you down or complaining the whole time? Now think about today. For a lot of people watching this, something changed somewhere in between. The legs started feeling heavier, a little slower to warm up in the mornings. Maybe some tingling or that cold, disconnected feeling that wasn't there before. And if you've brought that up with your doctor, there's a real chance you heard something like, "That's pretty normal for your age." And look, that's not entirely wrong. Circulation does change as we get older, but here's what that answer often leaves out: why it changes as fast as it does for some people, and what role specific nutritional gaps play in how quickly and how noticeably that change happens. That's exactly what we're covering today.
I'm Dr. Williams, and over the next 18 minutes, I'm going to walk you through 5 vitamins that research has consistently linked to vascular health and leg circulation in older adults. We'll go in order from supporting players to most impactful, and the one at the very top of this list is the one that surprises people every single time. Stay with me, because by the time we get there, you're going to want to have a pen nearby. But right now, before we go a second further, do me a quick favor. Drop a comment below and tell me your age and where you're watching from. I'll be referencing this as we go through the video, and it'll make everything much more personal and relevant. Before we get into the vitamins, I want to spend just a couple of minutes explaining what's actually happening inside your legs as you age, because once you understand the mechanism, everything else we cover today will click into place much faster. Your legs are working harder than almost any other part of your body when it comes to circulation. Blood has to travel all the way down from your heart, navigate through progressively smaller vessels, deliver oxygen and nutrients to your muscles and nerves, and then fight gravity to make the return trip back up. The vessels doing that work have an inner lining called the endothelium. Think of it like the smooth interior surface of a well-maintained pipe. When it's healthy, blood moves through cleanly and efficiently. When it becomes inflamed, stiffened, or gradually damaged over time, circulation becomes sluggish, your muscles get less oxygen, your nerves get less support, and you feel it in every step. Over time, a few things work against that lining in older adults. Oxidative stress accumulates. Vessels lose some of their natural elasticity. The nerve signals that regulate blood vessel tone can weaken. And for many people, more than most realize, specific vitamin levels quietly drop. Sometimes without dramatic symptoms in the early stages, sometimes for years before the effect becomes noticeable enough to connect the dots. That connection between specific nutritional gaps and declining leg circulation is well documented in the scientific literature, and yet it's something that often doesn't make it into a standard 15-minute clinic visit. That's the gap I want to fill today. Let's go through the 5 vitamins starting at number 5. Vitamin number 5, vitamin C, the foundation of vessel structure. Vitamin C tends to get reduced to immune support and cold prevention in most conversations. But for your blood vessels, it plays a role that goes much deeper than that. Your blood vessel walls are structurally reinforced by collagen. The same protein that keeps your skin firm, your joints supple, and your connective tissue intact. And here's the part that matters. Your body cannot synthesize a single strand of collagen without vitamin C present. It's a non-negotiable biochemical step, not a suggestion. The enzyme system that builds collagen E-prolyl hydroxylase and lysol hydroxylase requires vitamin C as an active coactor to function. When vitamin C is consistently low, that enzyme system slows, collagen production drops, and vessel walls gradually lose some of their structural flexibility, the ability to stretch and rebound with each heartbeat, which is exactly what's required to push blood efficiently all the way down to your feet and back up again. Research has consistently found associations between chronically low vitamin C and reduced vascular flexibility in older adults, particularly in the vessels supplying the lower limbs. For some individuals, and especially those who are genuinely deficient, addressing that nutritional gap may meaningfully support vessel wall integrity over time. Results will naturally vary depending on your baseline levels and overall health. Now, here's the practical mistake most people make with vitamin C that quietly undermines the benefit. Vitamin C is water-soluble. Your kidneys filter it out within 3 to 4 hours of intake. So, if you take one large dose in the morning, you spend most of the day running low. Your vessel walls are doing repair work around the clock. They need a consistent supply, not a single morning spike. The approach that research on vitamin C bioavailability supports is a distributed dose throughout the day. Instead of 500 milligrams all at once, try 200 millimeters with each main meal. This keeps blood levels steadier and gives your vessel walls more consistent access to what they need. For food, red bell peppers are one of the most concentrated sources available, containing more vitamin C per gram than most citrus fruits, along with compounds that naturally support vessel relaxation. Kiwi fruit is another excellent option with a fiber matrix that slows absorption and extends the benefit. If you're supplementing, buffered vitamin C or sodium asbate tends to be gentler on the stomach than standard ascorbic acid. Worth knowing if you've had any digestive sensitivity with vitamin C in the past. Vitamin number 4, vitamin E, the antioxidant shield for your vessel walls. Every single day, your blood vessel walls face something called oxidative stress. It's driven by unstable molecules, free radicals, that accumulate as a natural byproduct of normal metabolism. Left unchecked over years, that oxidative load contributes to inflammation, stiffening of vessel tissue, and a gradual decline in how well your endothelium functions. Vitamin E is one of your body's primary defenders against that process. And what makes it uniquely suited to vascular protection is where it works. It's a fats-soluble antioxidant that can embed itself directly within the lipid layer of cell membranes, including the walls of your blood vessels. That's where the free radical damage is happening, and that's exactly where vitamin E can intercept it. Several peer-reviewed analyses have found meaningful associations between higher vitamin E status and improved endothelial function, particularly in older adults dealing with elevated oxidative stress. For individuals who are genuinely low in vitamin E, restoring adequate levels may support healthier vessel wall function and better vascular response over time. As always, results vary depending on your health status and baseline deficiency level. Now, here's the detail that matters most when you're shopping for a supplement, and most people get this wrong. The majority of vitamin E products on store shelves contain a single synthetic form called alpha-tocopherol, but vitamin E is actually a family of 8 related compounds, 4 tocopherols and 4 2-trienols. And research suggests they work more effectively as a group than any single form in isolation. When you're reading labels, look specifically for mixed tocopherols. That one phrase is the difference between getting the full family working for you or just one member showing up alone. And since vitamin E is fat-soluble, take it with a meal that contains some healthy fat, olive oil, eggs, avocado. Without dietary fat present, absorption can drop significantly. A typical dose studied for vascular support is in the range of 200 to 400 international units daily. If you're on blood-thinning medications, check with your doctor before adding vitamin E at higher doses, as it can have mild anticoagulant effects. For food sources, raw almonds, sunflower seeds, and wheat germ are all solid natural options for working more vitamin E into your daily routine. If you're still here with me and finding this helpful, take a moment to type 4 in the comments. It lets me know you're watching and getting value from this. Vitamin number 3, vitamin K2, the calcium traffic controller. This is the one that surprises most people because almost everyone who's heard of vitamin K associates it with blood clotting, but that's vitamin K1. Vitamin K2 does something entirely different, and for the health of your arterial walls, it's remarkably important. Here's the problem it addresses. Calcium belongs in your bones, but as we age, it can gradually migrate into soft tissue, including the walls of your arteries. When calcium deposits accumulate in arterial walls, those vessels become stiffer and less capable of the expansion and contraction they need to do their job. This process, called arterial calcification, is a well-recognized contributor to reduced circulation and increased cardiovascular risk in older adults. Vitamin K2 activates a protein called matrix glow protein MGP, which functions as a biological gatekeeper. When MGP is adequately activated by K2, it helps direct calcium toward bone and away from arterial tissue. When K2 is insufficient, MGP stays dormant, and calcium has a clearer path to places it has no business being. The evidence here is some of the strongest on this list. The landmark Rotterdam study, a large decadal-long population study published in the Journal of Nutrition, followed nearly 4,800 adults and found that the highest dietary K2 intake was associated with a 52% lower risk of severe arterial calcification compared to the lowest intake group. The same study found a 50% reduction in cardiovascular risk and a 57% reduction in coronary heart disease mortality. An important distinction, because those are three separate findings from the same study, not one number that applies to everything. The calcification finding specifically is the 52%. This is compelling data, and it's been replicated in follow-up research, including the Prospect EPIC study of 16,000 adults, which found similar associations between dietary K2 and cardiovascular outcomes. Now, modern diets are severely short on K2. Traditional food sources, grass-fed butter, organ meats, naturally fermented foods have largely disappeared from most people's regular eating patterns. Unless you're regularly consuming natto, a fermented Japanese food that's genuinely an acquired taste, or certain aged cheeses, meaningful K2 from food alone is rare. For supplementation, look for MK7, the form with the longest active half-life in the body, around 72 hours compared to just a few hours for MK4. This means more sustained activity between doses. The range most studied for vascular benefit is 90 to 180 micrograms daily taken with a meal containing fat. And hold on to this next point, because K2 and the next vitamin on our list are one of the most important nutritional pairings I know of for cardiovascular health. I'll explain why in just a moment. Before we continue, tell me your name and where you're watching from. I read every comment, and I'd love to know who I'm helping today. Vitamin N2, vitamin D3, the vascular activator. Vitamin D has become one of the most researched nutrients of the past 2 decades, and for good reason. It influences nearly every system in the body, but its role in vascular health and leg circulation specifically is something that still doesn't get enough attention in everyday health conversations. Here's the mechanism that matters. Your blood vessel walls contain vitamin D receptors distributed throughout their structure. When those receptors are adequately stimulated by D3, they help trigger the production and release of nitric oxide, a molecule that signals vessel walls to relax and dilate, allowing blood to flow more freely. In practical terms, sufficient D3 helps keep the vascular pathway to your legs more open and responsive. For individuals who are deficient, this signaling pathway may become less active, contributing to vessels that stay more constricted than they should be. Observational data from the Framingham Heart Study cohort has found meaningful associations between lower vitamin D levels and markers of vascular stiffness in older adults. These are associations in population data, and it's important to say that clinical trials on D3 supplementation have shown mixed results, meaning the benefit appears to be most significant in people who are correcting an actual deficiency rather than supplementing on top of already sufficient levels. That framing is important. The goal isn't to take as much D3 as possible. The goal is to make sure you're not running low, which, if you're over 60, is a very real possibility. Here's why. Your skin's ability to produce vitamin D from sun exposure decreases significantly with age. Research estimates that adults over 70 can produce roughly 60 to 75% less vitamin D from the same sun exposure as a younger adult. Combined with the fact that dietary sources of D3 are limited, primarily fatty fish, egg yolks, and fortified foods, this creates conditions where deficiency is genuinely common in older populations, even in people who spend time outdoors regularly. This is also why D3 and K2 must be taken together. And I promised I'd explain this. Vitamin D3 increases your body's absorption of calcium from food. That's beneficial for bone health. But without adequate K2 to escort that absorbed calcium into your bones and away from your arterial walls, you could inadvertently contribute to the calcification problem we discussed in the last section. D3 increases calcium availability. K2 directs it where it belongs. They are designed to work as a pair. The protocol most commonly used in research: 2,000 to 5,000 international units of D3 taken together with 90 to 180 micrograms of K2 MK7 with a meal containing healthy fat. Your specific D3 dose should ideally be informed by a 25-hydroxy vitamin D blood test, because individual needs vary considerably based on your starting levels, sun exposure, body composition, and health status. Wild-caught fatty fish, salmon, sardines, mackerel are the gold standard food sources, providing both D3 and omega-3 fatty acids that support its vascular effects. But for most adults over 60, food sources alone are unlikely to maintain optimal levels, which is why discussing targeted supplementation with your physician is worth doing. If you're still here with me and finding this helpful, take a moment to type 2 in the comments. It lets me know you're watching and getting value from this. Vitamin number 1, vitamin B12. One of the most impactful nutrients for leg circulation, especially if your levels are low. And I want to frame this carefully from the start, because the research here is genuinely compelling, but it's most relevant for a specific group of people. The problem is that group is far larger than most people realize, and most of them have no idea they're in it. Estimates from peer-reviewed research suggest that anywhere from 10% to 40% of adults over 60 have suboptimal B12 levels. That number climbs further in adults over 75, particularly those on acid-reducing medications like proton pump inhibitors, those with a history of digestive issues, or those following plant-based diets. The reason has to do with a protein your stomach produces called intrinsic factor. Intrinsic factor is essential for absorbing B12 from food. After age 60, its production tends to decline. Stomach acid, also required for releasing B12 from food proteins, often decreases as well. The result is that you can be eating B12-rich foods consistently and still be absorbing far less than your body needs. This matters enormously for circulation. And here's why. B12 affects leg blood flow through not one, not two, but 3 distinct biological pathways, and that's what makes it unlike every other vitamin on this list. Pathway 1. Red blood cell quality. B12 is essential for the normal formation and maturation of red blood cells. When B12 is insufficient, red blood cells can become abnormally large and structurally fragile, a condition known as megaloblastic anemia. These misshapen cells are less efficient at navigating the small capillaries in your calves, feet, and toes, the very vessels where circulation already faces the most resistance. For individuals with B12-related anemia, restoring B12 levels has been shown to meaningfully improve oxygen delivery to the lower limbs, with some individuals experiencing notable improvements in leg warmth, responsiveness, and walking tolerance as their red blood cell quality normalizes. Pathway 2. Nerve-to vessel communication. Your blood vessels don't operate in isolation. They receive continuous regulatory signals from the peripheral nervous system, signals that tell them when to dilate, when to constrict, when to push more blood forward. Those signals travel along nerve fibers coated in a protective sheath called myelin. B12 is the primary nutrient responsible for building and maintaining myelin integrity. When B12 is chronically low, that protective coating gradually degrades. Signal transmission slows. Your blood vessels become less responsive to the regulatory instructions your nervous system is trying to send. This also explains why B12 deficiency and peripheral neuropathy so often appear together. The numbness, tingling, and burning sensations that many people over 60 attribute to normal aging, particularly in the feet and lower legs, are sometimes a direct neurological sign of long-standing B12 insufficiency. In some individuals, addressing that deficiency leads to meaningful improvement in those symptoms over time. The results are more pronounced when deficiency has been present for a shorter period and nerve involvement hasn't progressed significantly. Pathway 3. Homocyanin control. Homocyanin is an amino acid that when elevated is directly damaging to the endothelium, that inner lining of your blood vessel walls we discussed at the very start of this video. Elevated homocyanin is associated with inflammation, increased tendency toward clotting, and accelerated vessel wall damage over time. B12, together with folate and B6, is one of the key nutrients involved in converting homocyanin into safer byproducts. A study published in Circulation found that supplementation with B vitamins, including B12, led to significant improvements in flow-mediated dilatation, a standard measure of vascular endothelial function, alongside meaningful reductions in plasma homocyanin concentrations. Multiple meta-analyses have confirmed that B12 supplementation in deficient individuals can produce meaningful reductions in homocyanin, and lower homocyanin is consistently associated with better vascular health outcomes. 3 pathways, 1 nutrient. And when all 3 are contributing simultaneously, which happens quietly and gradually over years, addressing the underlying B12 gap can produce changes that feel significant to the person experiencing them. Now, here's an important note on testing, because the standard approach may not be giving you the full picture. The routine serum B12 blood test has a well-documented limitation. It measures both active and inactive forms of B12 together. This means your result can appear normal while your tissues are functionally running low. A more sensitive marker is methylmalonic acid, or MMA, which rises when B12 is functionally insufficient at the cellular level. If leg symptoms are something you've been managing, it's worth asking your doctor to add an MMA test alongside the standard B12 panel at your next visit. Now, the form and delivery method of B12 supplementation genuinely matters here, and this is where most people make an avoidable mistake. Because of the intrinsic factor decline we talked about, standard B12 tablets that you swallow whole must compete for the same compromised absorption pathway that already isn't working reliably. At supplemental doses, say 500 to 1,000 micrograms, high-doses B12 is actually absorbed primarily through passive diffusion, bypassing intrinsic factor, and this is where sublingual B12 has a genuine research-supported advantage. A systematic review and meta-analysis published in Frontiers and Pharmacology in 2025 found that sublingual B12 dissolving under the tongue appears to be as effective as intramuscular injections for correcting deficiency while being non-invasive, cost-effective, and something you can manage at home without clinical visits. For older adults who want to address a deficiency without the inconvenience of injections, that's a meaningful finding. The form of B12 also carries some nuance. Cyanocobalamin is the most common and least expensive form. It's synthetic and requires the body to convert it into its active coenzymes before it can be used. Methylcobalamin is already in the bioactive form, requiring no conversion step. While both forms have been shown to effectively correct deficiency in clinical studies, many practitioners prefer methylcobalamin for older adults, particularly for neurological support. For sublingual use, allow the tablet or lozenge to dissolve fully under the tongue. Don't swallow it early. The full dissolution time, typically 1 to 2 minutes, maximizes the absorption through the mucosal tissue. For individuals who discover they are genuinely deficient and begin consistent supplementation, a general timeline based on the clinical literature looks something like this. Within the first 2 to 3 weeks, many report their legs feeling warmer and more responsive. By 4 to 6 weeks, tingling and numbness that some had attributed to normal aging may begin to ease, particularly in those with earlier stage nerve involvement. By 3 months, walking tolerance and leg stamina often show meaningful improvement in those who were significantly deficient to begin with. These are real documented patterns. They're not universal. Individual results vary based on how long deficiency has been present, overall health, and how well it's addressed. But they represent what's genuinely possible when a meaningful nutritional gap gets properly corrected, and that's why B12 sits at number 1. Let me bring this full picture into focus before we close. Each of the 5 vitamins we've covered today works on a different part of the same vascular system. Vitamin C builds and maintains the structural collagen that keeps your vessel walls elastic and intact. Vitamin E protects those walls from the daily accumulation of oxidative damage. Vitamin K2 prevents calcium from depositing in arterial walls, keeping them flexible and functional. Vitamin D3 activates the nitric oxide pathway that tells your vessels to open up and allow blood through. And vitamin B12, the centerpiece. Ports are SIR and C. SIR ports healthy red blood cell quality, the nerve-to-vessel signaling network, and homocyanin control all at once. They're not competing with each other. They're complementary. Each one handles a different vulnerability in the same system. And for many people over 60, one or more of these vitamins is quietly running lower than it should be, sometimes for years before the cumulative effect becomes noticeable enough to question. The encouraging part is this. Nutritional gaps, unlike many other aspects of aging, are something genuinely addressable, especially when you identify them early. Approach them with the right information and work with a physician who can test your actual levels rather than guessing. That's what separates proactive health management from reactive crisis management. And the people who maintain strong functional legs into their 80s are almost always the ones who chose the first path. Here's my practical challenge for you before you close this video. Pick one vitamin from today's list. Ideally, the one that connects most clearly with what you've been experiencing in your legs. Then, take one concrete step. Either research it further or bring it up at your next doctor's visit and ask to have your levels checked. If B12 resonated with you, ask specifically for a serum B12 and a methylmalonic acid test. That combination gives you a far more accurate picture of your functional B12 status than the standard test alone. If D3 rang a bell, ask for a 25-hydroxy vitamin D panel. It's a routine test, it's inexpensive, and the result will tell you exactly where you stand. Don't try to fix everything at once. One vitamin, one test, one conversation with your doctor. That's how meaningful change actually starts. Then I want you to come back to this video and leave a comment. Tell me where you're watching from today. Tell me which vitamin surprised you most. Tell me if you're already supplementing with any of these and what your experience has been. I read every comment in this community,